Hi, this is Matt Tierney, and I am the faculty of record for the Interprofessional course in Behavior Change, which is going to take place on January 7th with students from the School of Pharmacy and the School of Nursing. And this brief video, hopefully no more than 10 minutes, is meant to introduce all of you to the skills session. And I want to thank all of you as faculty and facilitators, for helping facilitate the skills building. I'm going to walk you through the skills handbook in this video and sort of introduce what the goals of each of the skills are. Your goal as faculty on these is really just to facilitate practice. So I want to start by acknowledging that you don't need any expertise in motivational interviewing to help facilitate these skills. It may be helpful for you, though, to attend the didactic portion of the course, which is going to take place just prior to the skills sessions on January 7th. And a particular shout out to not only faculty, but also the second year PMHNP students and to the PMHNP residents at the San Francisco VA who are helping facilitate as well. So just a couple of rules of thumb to begin with. The first, as I've already said, is I hope you all are really just focused on helping students practice the skills and that you don't need any expertise whatsoever. The second thing I would encourage, since most of these skills are done either in the open or in pairs, I would like you to help the students pair up one pharmacy student with one nursing student and encourage learners not to be with people they know. As an interprofessional exercise, this is supposed to sort of enhance interprofessional dialogue, and our students are going to find themselves in many situations in their careers where they're working interprofessionally, maybe with people they don't have a lot of familiarity with, and hopefully this skills session can model some of that. I hope you throw lots of affirmations in the directions of the learners, just for trying things. Our whole mindset with these new skills is going to be beginner's mind. And our students are sometimes uncomfortable being beginners with things. They like to achieve expertise very quickly. And some of these skills are pretty hard to do, as they will quickly learn. So just encourage a learner's mind, a beginner's mind. And when they're doing things well, just make every effort to really affirm their attempts and their successes in this. Also, please encourage when we ask learners to do a role play in the role of a student. In the role of a patient. We don't want the students to sort of be the patient from hell. Unpredictable patients certainly scare students and they scare us as providers. And sometimes a way of getting comfortable with that is to sort of play the role of that difficult patient. But we don't want the learners to play the role of a difficult or problematic patient at all. Because again, the entire goal here is for students to have the opportunity to practice. And all they're going to be doing is managing a difficult patient if their partner is being difficult. So we'll ask students to please just be a kind of a run-of-the-mill patient, or the way that they would be a patient in an office. That way the skills practice can progress nicely. And finally, a word about a mindset of inclusivity and being aware of potential microaggressions, which might come up in some of these skills sessions. And I think maybe the best way to acknowledge when a non-inclusive environment or statement is made, or a microaggression sort of emerges, is to kind of roll with it as faculty and facilitators. So sometimes just a simple acknowledgement of saying, hey, thank you for bringing this up. And patients will make us feel emotions, which are difficult at times. And we have to strive to remain patient-centered and empathetic, which is really the goal of this behavior change module. And hopefully just that acknowledgement and redirection will help if some of those microaggressions emerge. I also want to encourage all of you to please feel free to text me during the skills session. Kirsten Bolano and myself will be sort of wandering around. So if you guys are really feeling like you need to have a question answered or a student need addressed, please feel free to text me. I'm going to be at 415 260-3855. Well, let me share my screen here and walk us through the skills handbook. Give me just a moment. Okay, hopefully the screen is visible at this point. The handbook will look like this. At this point, I only have the School of Nursing course number, but of course the corresponding course number for School of Pharmacy applies as well. So the first page of the skills handbook is our agenda, and we'll follow this very closely. I'm just going to walk us through this handbook in the next 10 minutes or so. The thing that's not in the handbook, I would like, as soon as the learners and facilitators get into the breakout rooms, please introduce yourselves. What your role is as a facilitator. The student should identify whether they're a pharmacy or nursing student, and you guys may opt to do an icebreaker. Here's a suggestion: if you want to ask learners to name their favorite cheesy movie or something like their favorite ice cream flavor, sure, go ahead. Sometimes that can help people just sort of get in the mood to do a skills practice in this kind of intimate way that we're doing. The other thing, I'll bring this to your attention when I get through the end of the handbook, is as everybody's returning to the lecture auditorium, so we'll have 90 minutes for the skills sessions, then about 5 to 10 minutes for a break and to walk back to the main lecture hall where we're going to do a debriefing for a couple of minutes. Ask learners to please consider the following question: what is the value of learning these skills interprofessionally? Because we want to discuss that in our debrief at the end. So let's move on to the first skills. The first two skills are very, very straightforward. The first is what we call batting practice, where every learner takes a turn at bat. And in this particular skill, we're going to ask them to turn closed questions into open questions. Here are the closed questions. And what you can do as a facilitator is just go around the room and take these closed questions in order and ask students to turn them into open questions. My suggestion, in order for each student to get a turn at bat in this batting practice, is to go around the room in order. But I also like to acknowledge in batting practice that if a student is feeling particularly stuck or just doesn't get the exercise yet, they can pass. They can say pass. Of course, every student can't pass because that would leave us with nobody sort of trying these skills out. But I don't want learners to feel like they're really under the Klieg lights when they're feeling a little bit stuck. So it's okay to pass. So I would suggest with each of these questions, asking the closed question to several students in a row, and then move on to the next question. You don't have to get through all of these, but you may. I do encourage you to just limit this to 10 minutes and then move on to the next thing. Then the next piece is just going to be a moment to reflect. I want students to just take a pause after this very first exercise and sort of think about what is challenging about behavior change and motivational interviewing. What are some of the lessons learned so far, either from the didactic portion of the morning or from this first skill? And if something really stands out to them as either being very challenging or so far a lesson learned, to write that down within these little blue pearls that I've put. And students can return to those later. It's just a place to sort of reflect on challenges and opportunities. So the second exercise is another 10-minute batting practice. Again, students can pass. And again, as facilitators, I'd like to encourage you, when students really connect with this exercise, to really do lots of affirmations. And the same thing goes here. Each of these statements, make them to the students in order. And I want students to give a reflection. And as time goes on over 10 minutes, the reflection should become increasingly complex, where students are reflecting meaning or reflecting emotion or reflecting feeling. And again, just take one of these statements and go in order around the room. Hopefully you can get through all of them, but definitely stop at 10 minutes again. Then the third tool, the third thing to practice is the roadmap tool. And this is 2 pages. So you'll see here's the description. And then students will actually use this literal roadmap that shows a fork in the road, a Y. And they'll explain, one student will be the clinician, one student will be the patient. And then they'll switch after 10 minutes. So there's a scenario. Read this scenario about the college athlete with asthma who's only taking a fast-acting albuterol inhaler and is not taking his long-acting steroid inhaler. The students will turn to each other in pairs. And the exercise begins with a patient statement. It begins with a patient saying, well, I'm back for another albuterol inhaler. Can't you just dispense 4 or 5 of these to me each month to save some time? And then the provider will then recommend using the long-acting steroid inhaler and will follow these instructions to use this roadmap for the patient. So I would encourage, there's 20 minutes for this exercise. What I would encourage is facilitators, you can either read this instruction out loud to all the learners or ask a learner or a couple of learners to read it. You can ask one learner to read the scenario and then you can read the instructions or another learner can read the instructions. And then they have 10 minutes each to practice this. I will tell you, I've done this exercise in 20 minutes. It typically does not take 20 minutes for learners to do. And if you get done with it early, please move on to the next one. So then the next exercise is the readiness and confidence rulers. Again, the first page is the instruction and description. And the second page is the actual rulers, the tool which the students and learners will use in practice. So the same thing goes here. There's a description to actually just use these 0 to 10 scales to rate readiness and confidence. There's another scenario. It's a patient who's doing very well following almost all instructions to control their hypertension. That includes taking medications, taking a low sodium diet, exercising vigorously for the recommended amount of time each week. But the piece is they have trouble adhering to the recommendations all of the time. And so these rulers will be used in this scenario. And again, one student will be the provider, one student will be the patient. They'll practice and then they'll switch. The patient will become the provider and the provider will become the patient. So I would encourage you guys to, once again, either as facilitators read the description and scenario and then instructions, or have students do that out loud before the exercise begins. And again, there's a very clear starting point. The starting point isn't to wander in ambivalence with the patient. Absolutely not. The point of this exercise is only to practice the rulers. So the absolute starting point is the patient begins by saying this exactly. I guess I can commit to taking the medication, reducing my salt intake, and exercising the recommended amount of time. And then the provider takes over and says this on a scale of 0 to 10. How ready are you to make this change? And they just follow this script in a very straightforward fashion. I want them to just get used to and go through the motions of using the rulers. And then there's just 2 more exercises. This is the one that's probably going to take the longest amount of time. In the didactic portion of the course, I'm really going to explain a lot of different techniques and tools for eliciting change talk. And I've listed them on this page and the next page. They'll have already seen these in the didactic portion of the workshop. What I'm asking them to do is to practice 2 of them that they would like to practice. There's not time to practice all of them. So again, they'll pair up, one provider, one patient, they'll practice 2 tools, and then they will switch roles once again. So same thing here. Read the scenario. This one about a middle-aged patient with hypertension who continues to smoke a couple of cigarettes a day. And then there's a very clear starting point. This time it's with the provider who says, as a healthcare provider, I'd like to revisit your smoking habit. Is that okay with you? And then they'll practice some of these tools. Again, please ask the learners not to be the difficult patient or the problematic patient. The whole goal of this is just to practice some of these tools for eliciting change talk. And then if the provider hears change talk, they can selectively reflect it. This is the one exercise that might take the full amount of time. And then finally, there is an exercise that's associated with planning. And not all aspects of planning. I do not want the students and learners in this exercise to go through all elements of a plan, just one. And namely, that's practicing the elicit, provide, elicit technique that they're going to learn in the didactic portion of the workshop. So once again, I would encourage you and students to read these instructions out loud and then just take 5 minutes each and then switch and another 5 minutes to practice the elicit, provide, elicit component of treatment planning. This is really the element of brief interventions. So this is meant to be very short, no more than 5 minutes. There's another patient scenario here who does not meet criteria for an alcohol use disorder, but for a couple months every year exceeds recommended daily limits for alcohol use. And so the entire goal in elicit, provide, elicit, the learners are going to practice eliciting information, namely, what do you know about the alcohol-related health risks and safe drinking risks? The patient will say whatever the patient says. And then the provider will provide some of this information. They'll say, well, for male patients, we recommend no more than 14 drinks in a week and no more than 4 drinks on any one day. For female patients, we recommend no more than 7 drinks in a week and no more than 3 drinks on any day. And for all patients over the age of 65, we recommend no more than 7 drinks in a week and 3 drinks on any one occasion. Because when people exceed those, they are embracing a higher level of risk associated with alcohol use, which can include injuries, traumas, certain cancers, and liver problems, and for young people, serious injuries. Then the goal is to do the other elicit question, the second elicit. What do you make of this? And how does this affect your own thinking about drinking? That's the exercise. I really just want them to practice the elicit, provide, elicit. And then finally, you're at the end of the skills session, and it's another opportunity just to reflect, to take 5 minutes and do a couple of things. First, we're going to use the blue pearls again and ask the learners to just document 1 or 2 things that were particularly valuable to them during the skills session, and then to do their own readiness and confidence rules. Ask the students on a 0 to 10 scale, how ready are you to practice these skills in a clinical placement? And then on a 0 to 10 scale, how confident are you that you can start practicing these skills in a clinical placement? And then it's break and return to the large lecture hall. And again, ask the students as they return to the large lecture auditorium to think about the question, what is the value of learning these skills interprofessionally? So once again, I want to thank all of you for agreeing to facilitate. I really appreciate your willingness, and please don't hesitate to contact me if you have any questions or concerns the day of the